Namaste, everyone. Welcome to today's Yes Talk. The title today is Osteoarthritis When Worn Out Joints Can't Take It Anymore. The speaker, Dr. Ramesh Bijlani, is a prolific writer and an inspirational speaker. He holds a master's degree in nutrition from MIT, USA, besides a doctorate in physiology from AIIMS, New Delhi. Once a professor at AIIMS New Delhi, Dr. Bijlani is now a spiritual seeker at Sri Aurobindo Ashram, Delhi branch. Dr. Bijlani, sir, thank you so much for sparing your valuable time for all of us. We look forward to your session.
Thank you, Arunima, and namaste to all of you, brothers and sisters. The blessings of the Mother and Sri Aurobindo to all of you from Sri Aurobindo Ashram, Delhi branch. Today we are going to talk about a very common malady, osteoarthritis, that is a degenerative disease of the joints. Now just imagine what a joint is. Two bones coming near each other and not really joining exactly so that some movement is possible at the junction. That is what a joint is. So instead of two bones, you can imagine two metallic rods. And if these have to move against each other, there'll be so much friction, there'll be so much of creaking. And to avoid that, one would try to provide some uh, cushioning material, and then they may rust. So we'll have to provide a lubricant, and still probably will not be able to do as good a job as the body does. Uh, for example, the knee joint, which is one of the perhaps the most commonly affected joint by osteoarthritis, is called a hinge joint. But then, even a simple hinge, like the one which just helps us close and open a door, uh, requires good care. And probably, if we impose on it the 60 or 70 kilos of weight that is imposed on our knees, and keep using that joint, not only using, sometimes misusing and abusing that joint for decades, day in and out, right, left, and center. Uh, Probably it will not last decades the way the knee joint does. Rarely does it complain before 40, and in many, is it goes on functioning without any protest, without any complaints, well beyond the biblical 70 and 10. So, with that little admiration for the Creator who has created us, which is something which we can do no matter which part of the body we are talking about, let's we turn to the PowerPoint. So, the topic is osteoarthritis. When worn out joints can't take it anymore. We consider this to be basically an wear and tear disease. Uh, Now, here's a quote that compares the two types of impact that a disease may have. One is what we call technically mortality, and there is this morbidity. Cancer has a high mortality, so it may kill a person, but in terms of numbers who are affected, arthritis ruins far more lives, which means the prevalence is much higher and the morbidity much greater than in case of cancer. So, as a cause of morbidity, arthritis far outweighs cancer. In fact, it is the leading cause of disability in the elderly. Now, here is the picture of a typical joint, uh, bone 1 and bone 2 coming close to each other, and to avoid friction and creaking, we have this cushion-like material, the cartilage, and then to provide lubrication, we have this fluid around the synovial fluid, and then this synovial fluid is produced by the synovial membrane, and the just the outer layer of the synovial membrane, or you can say just outside the synovial membrane, is a tough fibrous material which forms the capsule of the joint, which holds it in place. Now, this is what we see in a very simple joint. The knee joint, of course, is far more complex, as we shall see in a moment. But then, no matter which joint it should allow the movement that we want, that is the desirable movement. And at the same time, it should not allow unwanted movements. For example, I can move the arm like this easily, but then if I have to take the arm beyond this, further down, I can't. So it should not allow any unwanted movements, and the movement should be friction free, and then the joint should be protected, protected against infections, protected when we have a sudden fall, and protected when we start abusing it with the loading it with much more weight than it can carry. So all this type of protection also to some extent has to be built in. Now let's turn our attention to the articular cartilage. That is this cushion-like material. Articular just means in the joints. Cartilage, which we find in the joints, is articular cartilage, and its function is to firstly reduce friction because it's a cushion-like material. It also acts as a shock absorber. Uh, if we suddenly jump, then naturally there will be a shock here which has to be absorbed without damaging the bone. And being smooth and slippery, it reduces friction, but same time it does not really bind, does not make the bones sticky, lets them move freely. And of course, the lubricant will further add to that freedom of movement. The lubricant, the synovial fluid. Now let's turn to the joint which is most commonly affected, that is the knee joint. It is not only the largest joint in the body, it is also the most complex joint in the body. In fact, it is a marvel of engineering. Now here is a knee joint cut open, or you can see it has been cut along its length, and we are seeing it from the side. This is the front and this is the back side. Now in the front, we have, besides these two major bones, the femur and the tibia, in front a small little bone hanging here, the kneecap or the patella. And all these things have a function. But then to avoid friction, as we saw as in case of other joints, and to fulfill all the other functions like a shock absorber and so on, we have the cartilage covering the surface of both these bones here. But then still you find that the bones are rather ill-fitting. And to complete that fit, there's another cushion-like material, the meniscus. And there are two of them, the lateral meniscus and the medial meniscus, lateral on the side, medial towards the inside of the body, and lateral towards the outside of the body. And meniscus, these are not, these are sort of moon-shaped, not complete circles, just to fill this space so that in spite of being ill-fitting, now these bones are in a way sort of a perfect fit because of these extra cushions which have been provided in the knee. But then there are also other things which have, apart from protective function, also a cushioning effect. And this fat pad in the front here, the bursa here, and the bursa here. And then to stabilize the joint, there are strong ligaments. Ligaments, have a lot of very high tensile strength, which means you can pull them with great force and still they do not break. And yet, although they do not break, they should be able to stretch to allow the joint to move. So that is the combination which we have here, which is very difficult to achieve normally. Or one can imagine how difficult it is to have something which can be pulled like a rope, like a thick rope. You can pull it as hard as you like and still it won't break. But same time, it will be able to change its length so that the joint can move. So it should be able to stretch. So and then, of course, there are the muscles, the quadriceps in the front and the hamstrings at the back, which make the movement at the knee joint possible. And these muscles, apart from making the movement possible when they contract, also provide additional protection to the joint, as you can imagine, because they add to the girth and they are an additional layer of tissue which is soft and can provide some type of a protection. And of course, outside the muscles, further there'll be protection provided by a thick fascia and outside the skin and so on. So we have a whole lot of things covering the knee, uh, keeping it protected and yet allowing it to move the way it should and preventing the type of movements we don't want at this joint. Like a hinge, we can move the leg forward and backward, but we can't take it forwards beyond a certain point after the leg is straight. Not only that, at this joint, we can also have what we call a little medial rotation and a little lateral rotation, which means we can rotate a little towards the inside as well as rotate it a little towards the outside. So all that movement is possible. And on top of that, this is the joint that carries all our 60 or 70 kilos of weight all the time. And if we decide to carry some more weight, then that also uh, the same joints will have to carry. And so often we do carry weight, sometimes on the head when it will be distributed to both the legs, and sometimes in the hand when it will be asymmetrically distributed, which can sometimes add to the difficulties, in fact. Now, let's see what happens in osteoarthritis. It's basically a disease of the cartilage. The cartilage becomes thinner due to wear and tear. Of course, some people argue that it is not really wear and tear, it is an imbalance between thinning or damage due to wear and tear and repair. So some wear and tear is going on all the time, but then although the capacity to repair is limited in the cartilage, does repair. So that repair is also going on all the time. And that's why it continues to function properly. But when we reach a stage where repair can't keep pace with the breakdown, that is when the person starts getting symptoms. So it is not so much, not just wear and tear, it's an imbalance between wear and tear on one hand and repair on the other. Now, just imagine another thing one can marvel about. No man-made joint has this capacity for self-repair. It's repairing on itself on its own. So when due to wear and tear, this cushioning effect starts becoming less, bone starts rubbing against bone, and there's a grating sensation. And this is sometimes what the doctors call that I can feel a crepitus. And even the patient can feel this grating sensation, and little sound coming from the surface where the bone is rubbing against bone. Then, as a reaction to this, new bony material starts forming in the bone, around the bone from other tissues, and some of this bony material is called spurs. The spurs are particularly spiky bony material, which starts poking into the soft tissues around and adds to the pain. So these spurs can be extremely painful, in fact. This new bony material. This new bony material may sometimes be painful because of the spurs. And this new bony material may also restrict the movement because it is happening at the wrong place. So in a way, it is not a very wise response on the part of the body. But at the same time, when we are in trouble, we also sometimes make such responses. We know we can't really correct the problem, but we at least start indulging in some activity which may be without achievement. And that is what the body is also doing, it indulging in some sort of activity in response to this damage by, if not producing more cartilage or but by at the right place, but at the wrong places, producing some bony material. Or in Hindi we say that कुछ कर नहीं सकते तो कम से कम कुछ दौड़ भाग तो कर सकते हैं, हाथ पैर तो मार सकते हैं. So that is what the bone is also doing here, creating these spurs and bony material, which actually further restricts the movement. On one hand, the movement is restricted because of pain, uh, because of damage to the cartilage. On the other hand, the movement at the joint gets further restricted because of this additional bony material formed. Now, here is a picture showing a healthy knee joint, and the focus is on the cartilage because that is the tissue primarily affected in osteoarthritis. Now, this has, in the osteoarthritic knee, got damaged, and the bone has responded by forming this additional bony material here and there. Something similar happening in the hips here, a healthy hip and an osteoarthritic hip in which the cartilage is damaged, but some extra bony material has formed here and there. And the spine. Here we find that the spine is able to bend and twist because in spite of being a long bony column, it has these pieces, the vertebrae, and between the two adjoining pieces, there is a disc which has cartilage and fibrous tissue both, and also a balloon-like material at the center, which has viscous material and which is surrounded by a very thick ring of tissue. So that it's very strong. At the same time, that viscous material, jelly-like material, makes the movement possible. Now imagine standing from morning till evening, day after day for decades, uh, and the weight being borne by these discs would eventually lead to a reduction in the thickness of these discs and some damage to these discs. And the result is that they can become narrow. Now, here, when these become narrow, again, the response is similar. Some additional bony material may be formed here and there. As you can see, this bony material is now irregular as compared to this because of this response. And here, there's an additional complication. There are nerve roots entering and leaving the spine through these little holes. Now, because of this change in the structure here and formation of the additional bony material, there could be compression. And because of the reduction in the space here, there could be a compression of some of these nerves, leading to pain, which in a way is a warning, a message that something is wrong. And if the damage increases further and we don't pay any heed to this pain, it could also lead to a total death of the nerve, leading to loss of sensation and paralysis. So that's why damage of this type in the spine can be more disabling and disabling than, say, in case of the knee or the hip. Now, at this point, we are right point time to take up this question: does an afternoon nap help prevent back pain? Not the sleeping part of the nap, but the lying down part does help in preventing back pain, because just imagine at night we are lying down, so there's no weight being imposed on the back. During the day, throughout the day, we are imposing weight on this, and the result is that in these discs keep getting compressed slowly, so that if you take your height in the evening, it is a little less than early in the morning. That's because these discs are getting compressed throughout the day. Now, for 8 hours or so at sleep, there's no compression. The next 16 hours, we are awake and either sitting or standing, and there is a compression. Now, if you break the 16-hour interval between getting up and going to bed again into two, that is essentially what happens when you lie down in the afternoon, say soon after lunch. When you do that, then instead of 16, now this waking period is broken into two, 8 plus 8. So instead of 8 plus 16, now it becomes 8 plus 8 plus 8. So that is the difference it makes. And that's how during even the half an hour period that one is lying down after lunch, the discs which have got compressed since the morning get a chance to recover from that compression again and become somewhat like the way they were early in the morning. And then you are ready to compress them for the next 8 hours. So that is the difference the nap makes. So the nap does help, not the sleeping part of the nap, but lying down. And it helps by letting the intervertebral discs recover from the compression that has been going on since the morning. And what I was saying just has been shown here mathematically. Compare 8 hours that you are asleep plus 16 hours that is awake with 8 hours of being asleep. And for those who may object that if it is 8 plus 8 plus 8, that is 24. So where is time for the nap? So I just made it 7.75 here and 7.75 here, leaving half an hour for the nap. So you can see that now you have a gap here. The nap is a gap which lets the intervertebral discs recover from the compression since the morning. What else happens in osteoarthritis besides damage to the cartilage? Because after all, it's all one unit. Everything is interconnected. In fact, throughout the body, but especially in the joint, you can't expect the synovial fluid or the muscles and other things to remain completely unaffected if the articular cartilage has been damaged. So let's see what else happens. One of the things that happens is that the synovial fluid is also affected. Synovial fluid is called synovial because it is similar to the white of an egg. You know, ovial comes from ovum. Ovum is an egg. So this is viscous material has a consistency similar to the white of an egg, and that's why it's called synovial. It's a viscous material. It is watery. It also has phagocytes, which means it can take care of infections in the joint to some extent. And the functions of this fluid are it reduces friction because it's a lubricating fluid, it's a viscous fluid, and it performs the functions of the blood for the articular cartilage. This cartilage itself does not have a blood supply. It gets its nourishment from the synovial fluid. And it removes debris because there is some wear and tear going on all the time, as we saw. That cartilage is repairing itself, to which the nourishment from the synovial fluid helps because this nourishment is necessary not only for staying alive but also for repairing itself. But then the breakdown produces some debris. So the way the debris is cleared in other tissues by phagocytes, etc., and then eventually everything gets into the bloodstream and taken care of there. Here also something similar is happening. The phagocytes are there; they can take care of the debris. So that is also being removed. So all these are the functions of the synovial fluid. Now, the degeneration of the articular cartilage is essentially a function of age. And age affects all functions of the body, including that of the synovial fluid. The production of the synovial fluid also becomes less as a person ages. And that's how the synovial fluid, which we can see complements in many ways the functions of the cartilage, that is also affected in old age. And so, apart from the degeneration of the articular cartilage or wear and tear of the articular cartilage, aging decreases the production of this lubricating fluid, the synovial fluid. And now, because the person has restricted movement because of the pain in the joint, because of the bony spurs, the immobility also reduces the production of synovial fluid because production of synovial fluid depends partly on physical activity. Now, the person is moving about less, and therefore that further reduces apart from age and also changes the viscosity. If we don't move the synovial fluid around, it becomes more viscous than it should be, so it can't function properly with that higher viscosity. And the result is there is a further increase in friction because the lubricant is also not functioning properly, and there's a reduction in the nutrient supply to the cartilage, which means the cartilage will be damaged more and will be able to repair itself less. Now, here again, we can take up a related question. Why do we need a warm up before exercise, especially in the morning? Any exercise, including yogic postures, why do we start with a warm up, especially in the morning? Especially in the morning, because that is the time we have just got out of bed after a long period of immobility, and that's when the synovial fluid has become more viscous, and we need to move it around a bit to make it less viscous, and that is what we do in the warm up. And we need it more in the morning because later in the day, even if we take exercise, we have been doing we have had some sort of movements because of our daily routine. So not so much is required in the later in the day. It's the same way the elderly require more warm up before exercise than young people because with age we are making less synovial fluid. So staying immobile makes the synovial fluid viscous, and therefore we need the warm up to move it around, make it less viscous. Movement reduces the viscosity and increases the production of the synovial fluid. What else happens in osteoarthritis? Aging makes the ligaments shorter and reduces their flexibility. Aging affects all parts of the body. And ligaments also become shorter and become less flexible, which means the range of movement is further restricted also because of these changes in the ligaments. And this is particularly felt in the back. Now, here are some yogic stretches. Hastottanasana, which is one of the steps in Surya Namaskar, and Padahastasana, which comes immediately after the Hastottanasana. As you'll see, one of the basic principles in yogic postures is every pose is followed by a counter pose. So in this one, she's bending backwards. In the next one, she's bending forwards. But then just look at the flexibility of her back. Yeah. When she's doing this Padahastasana, trying to reach the feet with her hands, she is not satisfied with just touching her feet. She has stretched out her palms so that she had to bend still more. And she can do that. And why can she do it? How can she do it? Because she's in her 20s. A man in his 60s or 70s perhaps will not be able to do it. At least I can't. My flexibility is much less. Now that is natural because the length and the flexibility of the ligaments is becoming less with age. But then the effect of the aging will be less if a person has been regularly physically active throughout life. the effect of aging will be reduced. It will not, aging cannot be stopped, but it can be slowed down. Here is another set of postures in which there is a very acute movement. Here she is bending forwards like this, not only touching the feet, but again trying to clasp her feet with her uh, hands, which requires further bending. And then the counter pose after that to neutralize the stretch is Konasana, Paschimottanasana, and then Konasana, the counter pose. So this shows and the flexibility that is possible in the back when a person is young, the degree of flexibility we have. But then this restriction which we have with age because of the reduction, most of the time does not really affect us much because we do not require this type of flexibility in everyday life. For a routine activity, we do not need this much flexibility. And therefore, your daily life is not affected. You're not disabled uh, because of a reduction in this. Now, what are the symptoms of osteoarthritis? Pain, we can understand if there's so much damage and there are nerves uh, within the joint, so they'll be stimulated by all the damage that is going on. So there is pain. And we have seen there is restriction of range of movements because of the bony spurs forming, because of the changes in the ligaments, and so on and so forth. So restriction of the range of movement. The pain itself will make the person move the joint as little as possible. And the stiffness in the body, stiffness in the joint because of, again, uh, the pain and the restriction, and also the synovial fluid becoming more viscous because of age, because of restriction of movement. And the person has an inherent tendency in this type of situation to restrict physical movement as much as possible. And the result is the muscles also start becoming weaker and atrophied, because if we don't use a group of muscles, they become weaker. If we use them, they become fatter and stronger. So muscles become weaker. And we saw that muscles also have a protective effect. So that protective effect also becomes less. And weaker muscles also means greater difficulty in performing any movement. So that further restricts the movement, and also uh, restricts this muscle weakness, restricts the movement, and takes away to some extent the protective effect of the muscles on the joint. Now, here again, we can take a related question. Why is the pain of osteoarthritis felt more at night during the day? In fact, all types of pain are felt more at night. Even the itching of a skin lesion is also felt more at night. And the explanation for all these symptoms being felt more at night is that at night we are paying more attention to them. In the daytime, we are distracted by so many activities that we are not paying that much attention, and therefore these symptoms are less. At night, we are paying more attention. But apart from that, in case of, say, a disease like osteoarthritis, the pain is more at night because at night, the muscles are totally relaxed. And we saw that the muscles have a protective effect on the joint. So when the joint can uh, move about carelessly, you can say, when the muscles are relaxed, the movement of the joint becomes, you can say loosely, careless. So that careless movement without the muscle protection can be painful. And that is why the pain is more at night than during the day. So at least two reasons why the pain is felt more at night than during the day. First, at night, the joint receives more attention. Secondly, at night, the muscles are completely relaxed. That takes away the protective effect that the muscles have on the joint. And this is a question related to another question which we took up some time back. Why is the stiffness of osteoarthritis at its maximum in the morning? Because again, at night, there has been no movement. So early in the morning, the synovial fluid is at its most viscous. And that is why there is greater stiffness. And through a warm up, we can make the synovial fluid move around and overcome the effect of this stiffness. So that's why before going to proper postures, even in yogic practices, we have a warm up. At least this stiffness is at least partly because the joints are essentially immobile at night. That makes the synovial fluid more viscous. That is also the reason why one has to spend more time on pre-exercise warm-up in the morning. Now, what are the risk factors in osteoarthritis? Risk factors means taking care of them so that we are less at risk. The top risk factor is age. Now, the paradox is nobody wants to age, and yet everybody wants to live long. Hmm. Now, the two can't be compatible. But at the same time, if we take good care of the body, and we have been talking in so many sessions about what a healthy lifestyle is about, one can slow down the aging process. But one can't avoid it altogether. So, if one lives long enough, sooner or later, the effects of age would be felt. But then here's a little lighter in the lighter vein about the aging process. Life begins at 40, but so does arthritis, and also the habit of telling the same story 3 times to the same person. All this starts at 40. Now, apart from age, the another risk factor is heredity. Because there are so many lifestyle diseases, but everyone does not get all of them. We get a few, and the few that we get are primarily determined by our heredity. Because the weak points in our body are inherited. We don't inherit the disease itself, but at least a tendency to get that disease. So, if that tendency is coupled with an unhealthy lifestyle, one is likely to get the disease which our parents had. So, heredity does play a role in osteoarthritis too. But then, through a healthy lifestyle, we can certainly delay the expression of that hereditary tendency. That can be delayed. And if we delay it beyond 70 or 80, it's as good as not having it at all. Because after that is age, in any case, we are prepared. Kuch na kuch to hona hi hai. So after that, we are prepared. But till that age, one can postpone the effects of the heredity. One can prevent the expression of that hereditary tendency for certain diseases. Now, these two factors, age and heredity, are what are called technically the non-modifiable risk factors, which you can't modify them. You don't have to work on them. What we can work on is are the modifiable factors. And here are two interrelated modifiable factors: overweight and a sedentary lifestyle. Sedentary lifestyle and even otherwise an unhealthy lifestyle in terms of diet, etc., all that will promote overweight. And one can understand why, particularly in joints like the knees and the hips, because these are the joints which carry that weight. So if a person is 10 kilos overweight, it's like carrying a 10-kilo suitcase on the head all the time. So just imagine the effect. Now, how does the doctor reach the diagnosis of osteoarthritis? Primarily by history. The patient complains of pain, restriction of movement, and all those things. Looking at the age of the patient and the complaints, the doctor suspects osteoarthritis. Then he examines. During examination, he tries to move the affected joint, and through experience, the doctor knows that if there is little sound felt inside the joint because of grating of the bones and the restriction of movement, the patient winces because of pain when the joint is moved, then the doctor knows that yes, this is osteoarthritis. So which is osteoarthritic pain and which is pain in the joint due to some other cause, like say uh, inflammation of the joint or some injury to the joint, the doctor can make out through examination. Then it can be confirmed by X-ray. But the X-ray may not always correspond to the illness. The person who has reached a certain age may show X-ray changes which are because of age but may not have the symptoms. On the other hand, a person may have symptoms which may not show up uh, in the X-ray, or at least the changes in the X-ray are not commensurate with the degree of symptoms. That can happen. So, in fact, history and examination are in that sense more important than the X-ray. There are no blood tests which are really specifically abnormal in osteoarthritis, but still they are sometimes done in cases of doubt to distinguish between osteoarthritis and some other forms of arthritis in which blood tests may be abnormal. And one such situation is rheumatoid arthritis. Now, osteoarthritis is basically an wear and tear disease. On the other hand, rheumatoid arthritis is an autoimmune disease, which means the body has started making antibodies which damage the tissues of our own body, and in this case, the joints. In osteoarthritis, the tissue primarily affected is the cartilage. In rheumatoid arthritis, it is the synovial membrane, which is inflamed. So this is an inflammatory disease affecting the synovial membrane. This is a degenerative disease affecting the cartilage. The joints typically affected in osteoarthritis are big joints. In rheumatoid arthritis, small joints like the finger joints. And in osteoarthritis, the blood test is normal. In rheumatoid arthritis, the blood test may show elevated levels of rheumatoid factor. And if we do some other tests like anti-nuclear antibodies, etc., they may also be elevated. So blood tests help us in distinguishing between these two in cases of doubt. Because osteoarthritis can also sometimes affect small joints. Now, the treatment of osteoarthritis. Osteoarthritis is not curable, but it is manageable. The fact that it is not curable gives us this joke in the next one. The doctor called Mrs. Cohen saying, Mrs. Cohen, your check came back. Couldn't be encashed. Bounced back. Mrs. Cohen answered, so did my arthritis. Now, the treatment of arthritis. Uh, Probably the first thing to talk about is exercise, and the question arises, which ones? Walking, generally considered simple and safe. Among specific exercises, quadriceps strengthening exercises and gait training. Quadriceps strengthening, that is the muscles in front of the thigh, and gait training, how to walk. Because if you walk properly, then the effort required by the muscles and the weight imposed on the knee can be reduced. So walking properly can also help. So gait training. Then swimming. Swimming is considered very good because the effects of gravity are completely avoided, and therefore, even a person having a pretty severe joint disease can swim without much pain. And then the yogic postures. And we'll not go into postures which may be very specific for osteoarthritis, but I have seen that and I've been suggesting people, and they say it helps a lot. Even simple exercises of the knee, which normally we do as a part of the warm up. Now, here there is loosening of the knees going on. She has lifted up the thigh with her hand, and the leg, taken the thigh, bent the leg like this, and taken the thigh towards the abdomen, and then she'll bring it back. So, normally we do it, say, around 5 times. If a person has osteoarthritis, what I suggested, do it 10 times at a time and do it 3 times a day. Because this is something which does not require you to be on empty stomach, can be done anytime. So do it 10 times, 3 times a day. And one can understand why it helps. It's because uh, of firstly producing some strengthening of the muscles, stretching the ligaments, making them more flexible, and most important, perhaps, helping in making the synovial fluid move around so it does not get too viscous. Here is another one, which also I say the same thing, 10 times at a time, 3 times a day. And rotation, not at the ankles, I should have written rotation at the knees. This is a mistake, rotation at the knees. So again, lift up the leg, but lift it further up more than uh, in this case, and just move around like this, and then bring it back. There's a mistake here. This is rotation at the knee. Of course, one can have rotation at the ankles also in warm up, but what is relevant here and what is shown in the pictures is rotation at the knee. Then loosening of the hips, particularly for osteoarthritis of the hips. And the simpler way to do it is one leg at a time. So the right leg is stretched, you can see, and the left leg has been bent to bring the heel as close to the body as possible. And she has facilitated this by lifting up the knee, and then she's trying to press it down as much as one can. A person with osteoarthritis of the hips, and particularly any person even without much osteoarthritis with age, may not be able to push down as much as she has been able to do. Again, the effect of age, but then take it down as much as you can, and then bring it up again and take it down again. So just taking it up and down, it resembles the way one rocks a baby. So, that sort of a movement. So that loosens the hips. So do it with one leg and then the other leg. So 10 times with one leg, 10 times the other leg, and 3 times a day for hips. So we've seen walking, some specific exercises, yogic postures, swimming, and climbing stairs. Now, this is a controversial thing because climbing stairs can be painful for many patients. And some people also believe that it can damage the knees further. And therefore, it raises many questions. But climbing does give exercise and more exercise than simple walking can. So, can this exercise help in prevention and treatment of the disease? Because we've seen exercise in general helps directly as well as by reducing the body weight or by imposing too much of weight on the knee or making the knee work more than it can. Does it increase the risk? Does it do any harm? Some people go to this extent of saying that man was basically designed to walk, not to climb stairs. So it is not something which will do any good to the knee and the hip joints. Does it do some good directly by providing exercise or uh, indirectly by reducing the body weight? And if on the whole one decides to do it, how to do it in spite of the pain, because there's a resistance to any type of exercise because of the pain. So we'll take this stairs question a little in detail. And this is sort of a summary of what you have from different sources. Climbing stairs is a greater strain for the knees than walking. This, of course, is acceptable. But same time, and going down the stairs is more strenuous than climbing up. This also is something which somewhat contrary to common sense. But all the same, climbing the stairs gives a workout to the quadriceps as well as the hamstrings, which means can strengthen these muscles, which are important, which means it can do us some good. And climbing the stairs also helps by facilitating weight reduction. And the general conclusion is that stairs may hurt, which means some pain may be there, but will not harm the knee joint. And of course, finally, as in all such cases, listen to your body. Uh, your body tells you whether on the whole you are damaging the body or uh, helping it, and to what extent you can do it. For example, is one flight of stairs okay, but not two, or are two flights of stairs okay, but not three? Slow climbing or fast climbing, what speed is okay? All these things your body tells you, and it's better to listen to the body. If you do a little bit more than what your body feels comfortable with, it will be a challenge, and it can help by further improving the flexibility and the strength. But if one goes much beyond that, then instead of helping, it can harm. So either just stay in your comfort zone where you are comfortable or just go a little beyond it. That is the general principle when you're listening to the body. And the whole thing should be done very consciously. When you do it consciously, you are unlikely to damage the body. So do it with full awareness of what you're doing, focusing only on that part of the body while doing it, not thinking of something else, not speaking on the cell phone as you're climbing the stairs. Now, here is a very good piece of information I discovered on a website called the creakyjoints.org. And these are very valuable tips that when you're climbing up, put your stronger foot first and then the other one. So every time, the stronger foot should be forward, the one which does not have much pain. And while coming down the stairs, do it the other way around. Put the painful joint first and then the stronger one down. Secondly, use the handrail if available. Then put the entire foot on the step, not just the front of the foot, not just the toes, but the entire foot on the step, which means very narrow steps can be difficult to climb. And further, this has been clarified, putting the entire foot that when you're climbing up, push up from the heel, not from the ball of the great toe. And if you're carrying weight, then firstly, avoid carrying it. If you have to, carry it in the most ergonomically safe manner. Carry as little weight as possible. If there's a lift available, then at least use the lift when you're carrying a weight. You may use the staircase otherwise. And if there's too much weight to be carried, distribute it in smaller pieces, portions, if possible, in 2 or 3 bags, and carry one bag at a time. So these are all different common sense tricks which one can use, but weight can really be dramatic. So carry it properly and carry not more than what you are comfortable with while climbing the staircase or coming down the staircase, because coming down is no less strenuous. In fact, it's more strenuous than climbing up. Now, apart from these exercises, physiotherapy, the specialist can guide on that. Weight reduction, you will find a very comprehensive uh, class on weight reduction in the course Yes.04 theory, for which there's a separate playlist. I think the title of that session is The Mother of Many Maladies, Overweight. Painkillers we'll not talk about. Uh, the safest is paracetamol, but then no painkiller is safe if taken over a very long period of time. So they should be avoided as much as possible. There are other options like giving injections into the joints and surgery, which has advanced quite a lot, especially after total joint replacement, total knee replacement, total hip replacement. But those are things which are left more to the specialists, and I'll not go into that. The general public, uh, if it is to be told, that also should be told only by a specialist, and we'll try to arrange a session with a specialist if possible soon to talk about particularly these things, the painkillers and injections and surgery. About Ayurveda, again, I'm not an expert, and we'll try to get experts to talk about it in the near future. Uh, but basically, the viewpoint of Ayurveda is that uh, the joint problems are basically a result of the uh, dominance of the vata. The three basic principles, the kapha, pitta, and vata. So it's the vata dominance which leads to osteoarthritis. And vata dominance is seen in terms of seasons from June to September, that is during summer and rainy season. So we are about to be through that now that we are nearing the end of September. But then those who have joint pains might have noticed an aggravation during this season because uh, and the disease is because of vata dominance. And this season there is vata dominance, particularly in the rains, when there is not just dominance but what's called prakopa, that is vitiation, which is worse than just accumulation of that dosha. So what is the way? And those people who have in their prakriti a vata dominance, so much the worse. So if there is prakriti is vata dominant, the season is has a vitiation of vata, then what to do? Then the principle is to give a diet which will not aggravate vata, and give particularly those foods, that avoid foods which will aggravate vata, and emphasize foods which can pacify vata. And then there are, of course, specific drugs in Ayurveda. But then, as I said, we'll try to get the specialists to talk more about these things in the near future. Now we'll turn in a little different direction, focusing on pain anywhere in the body. And pain is the commonest symptom which takes patients to doctors, no matter what disease it is. Now, this person, Norman Cousins, he got severe pain due to ankylosing spondylitis, which is an autoimmune disease. Again, affects the joints in the spine, particularly. And he cured it. It's an incurable disease. Not only incurable, but uh, it also is fatal. Only 1 in 500 survive. So, to cut a long story short, he essentially cured himself with a combination of laughter and vitamin C. And he documented the results. He found that 10 minutes of laughter after, say, watching a humorous video, 10 minutes of laughter gave him about 2 hours of pain free existence. And we have a physiological explanation for that. Laughter releases endorphins. Endorphins are a natural inbuilt painkiller within the body, resembling opium. And we know opium is a very strong painkiller, but normally we don't use it because it's addictive. But the opium-like substance released in the body is not addicting, uh, because released in small amount at just the right time at the right place. It's not addicting, and therefore it's a safe way of doing it. And he did it. So laughter is one thing which can help in pain. And if you want to know more about his personal story and how he reached all this, again there is a talk available which we have uploaded once again recently. Earlier it was in Yes Talks. Now recently it has been uploaded in a new playlist which is still being constructed. And the title of this new playlist is Scientific Medicine, a Wide Angle View. So there again, you'll find the story of Norman Cousins. Now, here is another very remarkable man, John Kabat-Zinn, who is a pioneer in bringing mindfulness as a major tool in mind-body medicine. And his program is, he ultimately named Mindfulness-Based Stress Reduction, MBSR. And here is what he says in his classic Full Catastrophe Living. Uh, Aversion to pain is really a misplaced aversion to suffering. We equate pain with suffering. So when we say that I don't want to have pain, actually what we mean is I don't want the suffering which pain can cause. What we forget is that the pain and suffering can be two different things. Just because we have pain doesn't mean that we also have to suffer. Suffering is one of the many possible responses to pain. So suffering is a response to pain, and there are alternative responses which can take away the suffering. And let's see, how that can happen. One is suffering will be greater if we imagine that this pain can have certain implications. If we believe that this pain can be because of cancer, naturally the person is more frightened of the cancer and therefore the suffering is more. Here in osteoarthritis, he knows that it will not kill me. So that can be a positive thing. At least the implications are not as serious in terms of life itself as in cancer. Whether there is anything positive in the situation. One positive thing is that it will not kill me. That itself is something positive. Apart from that, in osteoarthritis, is there anything else that is positive? One more positive thing in osteoarthritis is that it is limited to the joints. It will not affect other parts of the body. Like in autoimmune diseases like rheumatoid arthritis, eventually all other parts of the body or many other parts of the body may also be involved. But in osteoarthritis, other parts of the body are not affected, at least by osteoarthritis itself. They may be affected independently because of another disease process, but osteoarthritis by itself affects only the joints. So that is again something positive about osteoarthritis. But then how we look at the pain makes all the difference. That is the key thing. And from the spiritual point of view, all situations, everything that happens is an opportunity for spiritual growth. Pain is also that. And that is how uh, looking at it differently can help. And suffering need not be the only way we respond to pain. So, suffering is only one of the responses, and we have a choice how to respond to the pain. And in the same book which I was talking about, Full Catastrophe Living, John Kabat-Zinn says, pain is a very effective teacher. Now, this is a positive way of looking at the pain. Now, let's turn to spiritual masters. This is what Sri Aurobindo says about pain in Savitri. Pain is the hammer of the gods to break a dead resistance in the mortal's heart. What type of resistance does it break? The resistance to turning to the spiritual path. By and large, we remain rooted, our life remains organized around the physical and the vital, that is, the bodily needs and emotional needs. And we bring in the intellect to a limited extent, but in a rather crude manner. Not even the most refined possibilities of the intellect are used for organizing our life. I'm not saying that we are not aware of these things. We are aware of the intellect, we are aware of the soul. I have a soul. But then when it comes to organizing our life, basically it revolves around the bodily needs and emotional needs. Now, therefore, we are resistant to turning to anything which will disturb this comfort zone. And that's why there's a resistance. The comfort zone in which we have got settled, where the life is basically catering to the physical and emotional needs. So to break this resistance, we need this pain as a wake-up call. So it is a hammer that breaks or interrupts the slow inertia as of a living stone. So we are like a stone that happens to be living, a stone with a life, because the stone also wants to stay as it is. The stone doesn't move on its own, doesn't want any change. So we behave in a way like that stone, although we are living. And to break this inertia, that is to stay as we are, we require pain. So pain is the hammer that gods use, and they use it for our own good. And therefore, on the next page after this, he calls it heavenly cruelty. So this is cruelty on the part of God to give us that pain, but it's a heavenly cruelty. That's a cruelty which has a great deal of love and affection in it, the type of love and affection we associate with God and heaven. Pain is the nature of, pain is the hand of nature sculpturing men, sculpturing is molding to greatness. So it sculpts us to our greater version, to a version in which we are greater than we are now. So it's an inspired labor. God is also putting in a lot of labor to change us, to sculpt us. So it's an inspired labor, chisels with heavenly cruelty and unwilling mold. The mold is unwilling, but then this heavenly cruelty in the form of pain manages to chisel this unwilling mold into a great statue. So it may be like a stone, but then there's a statue residing in each stone. And to bring out that statue, we need to chisel the stone. And that is what this heavenly cruelty does. It's because of looking at pain in this way that spiritual masters like Sri Ramakrishna have had pain, but they have not suffered. Sri Ramakrishna had throat cancer, which was very painful towards the end of his stay in this world. Uh, and he was just about 50 at that time, as you can see. He lived in this world for just 50 years during this life, which we are familiar with. Uh, he got cancer. Doctors advised him total silence as part of the treatment. But he said, if the purpose of my life is served by preaching, by talking to people, I'll go on doing that. And he went on doing it till the last breath because he was not suffering because of pain. Sri Aurobindo also during his last illness was asked by the doctor, what are you suffering from? A very common question which even lay people ask somebody who is some patient who is not well. What are you suffering from? Sri Aurobindo said, doctor, I don't suffer. So in other words, pain is inevitable. That's a part of life. Even spiritual masters have had that pain, but suffering is optional. Uh, this presentation has been greatly facilitated by all the resources available on the internet. If one had to go to the library, perhaps one will have to spend days and weeks for which there's never any time available. So Google, which has the search engine on which you find everything, Wikipedia, uh, a page on just about everything under the sun, including a page, not a page, but you can say that page runs into more than 20 pages on osteoarthritis. Then from two very well-known clinics among the top clinics in the US, Mayo Clinic and Cleveland Clinic. They both have some beautiful material on the internet on osteoarthritis. And the funny quotes were from A to Z quotes. Most of you watching this are familiar with our YouTube channel, Yes Spirituality YouTube channel. And the yogic practices shown in this presentation are all available in this channel in the playlist Yoga Asanas and Pranayamas Basic. Right at the beginning of every video in this playlist, because every video starts with a warm up and Surya Namaskar, and that you find in almost every video in this. Apart from the other practices, because in general, we don't really actually encourage doing specific practices for specific diseases. So you don't have to concentrate on what will help osteoarthritis. What one has to try and do is do everything except what may harm you or except what you cannot do. Your body tells you, though it will be harmful, it will be painful. So that you can avoid. But everything else you should do because the illness that takes you to these practices should be used as an excuse for becoming healthier and happier in general. And that is what these practices will end up doing. And if you have any questions or comments, or just want to stay in touch, be on our mailing list, drop an email to yes@yesspirituality.com. Gratitude to the Mother and Sri Aurobindo for making the session possible. And thank you all for being there.
Thank you so much, sir, for a really comprehensive yet simplified talk on this subject, osteoarthritis. Let's see if we have any questions. Sir Shri Vidya asks, is gout arthritis different?
Yes, gouty arthritis is different. Gout is because of a rise in the uric acid levels. Uric acid is a metabolic product of DNA and RNA, and they break down in the body. And of course, I mean, everything is breaking down and is being reconstructed. So their breakdown lead to the formation of uric acid, which we pass in the urine. But excessive breakdown or the kidneys not getting rid of it sufficiently can lead to an accumulation. And generally, it is overproduction rather than the kidneys not being able to eliminate it. And this overproduction of uric acid can then lead to accumulation of uric acid in the joints, particularly the great toe. And that's what gives the pain in the joints.
Thank you, sir. Participants, if anyone else has a question, please raise the hand or you can put the question up in the chat box.
Hi to everyone. Thanks, Dr. Bijlani, for your presentation and provided information. May I just clarify with you about cycling and osteoarthritis?
Yes, cycling would also be a good form of exercise. I didn't think of it while talking, but it should be a bit like swimming because you're not putting your whole weight on the joint. So in that sense, it will exercise the joint without imposing the whole weight, the way it happens in swimming. That same thing would happen during cycling as well.
Okay, thank you very much.
So, we have a request for some future session from Vidya on carpal tunnel syndrome, if possible. Some other time. No more questions as such. Thank you again, sir. Okay, another question. Is it okay to start weight training post 40 years?
There's no age bar, but certainly post 40 is not the time to start on any strenuous exercises. And weight training is one of the strenuous ones. And particularly for the joints, which may be already uh, sort of might have damaged, although the person is not feeling it. Because 40 is the age at which, very often the process of aging has started, but there are no symptoms. So a person feels, I'm still young, I can do everything that I did as a young person. But the damage has begun. Damage begins after 25, in fact. So by 40, there's significant damage, although still there are no symptoms. The person is not very aware of the aging process. But then doing anything which will accelerate the aging process is not really desirable after 40. So after 40, jogging, especially for participation in competitive sports, weight training, these are undesirable. That's the way I would look at it. Gentler things like yogic postures, which are gentler and safer, partly because of their nature and partly because they are done with full awareness. Say, even if you stretch a lot, in weight training also you stretch, but weight training you stretch with a jerk like this. You bend, hold the weight, try to hold it as fast as possible, and then with a jerk you take it up. Now, in yoga, when you're taking the arms up, say, Hastottanasana, we saw, it is not like that. Say if you imagine a rubber band and you have to stretch a rubber band. One way is this. This is during weightlifting. Whereas in yoga, what do? You do it like this. So you're doing it slowly. So you're giving time for the tissue to adapt. And also you can be fully aware, you know, which is the point at which to stop, not to go beyond it. In fact, when you reach that point when you know should not go beyond it, step back a little and hold there. Weightlifting is not like that. It's a jerky movement with a lot of weight.
Not anymore, sir. Thank you again. Thanks a lot for a wonderful session. I thank the participants as well for being with us today. We can close today's session with a moment of peaceful silence. Namaste.
Namaste. Thank you.